For the next 10 minutes, I just want to take a look at research and research value and really look at maybe some trends in research in physiotherapy and how we can increase the impact of physiotherapy research globally. So I just want to start by talking broadly about research, and the definition of research, I guess, will be familiar to a lot of people. We look specifically at, health research or medical research, and there's really such diversity now in what research means. We maybe traditionally would have thought of clinical trials and clinical studies, but now we have to take a much broader view and think about cohort studies, case studies, and some of the other studies that we've mentioned here. So, as well as physiotherapists having a really important place in health services research and epidemiological studies with data, etc., now we're also really looking at, well, what are the factors that influence health? And there's physiotherapy studies now looking at social factors that impact on people's health, behavioral factors, economic factors that impact on people's health. So it's really such a broad area. And I guess there's so much scope for us to be involved in this type of research. So then thinking about what is the value then that this research brings? Well, this is such a long list and so diverse, but really the Institute of Medicine came out with this report, and it's from 2009, but really it was a very detailed report looking at how we can improve health through research. And they just outlined some of these benefits. So we can look at disease trends and risk factors to almost try and get ahead of some of the health issues that affect populations. We can really examine the outcomes of treatment and in public health interventions. And really, we're talking here about really high quality, cost effective care. And that's where research is going to point us in the direction of. We can look at functional abilities, and for our area, I guess, look at where are those functional abilities lower and where should we direct our interventions, patterns of care. And increasingly, we're really asked to make the case for a lot of our interventions based on cost benefit, based on maybe cost utility analysis or broader healthcare costs and use. So we really need to look at, okay, that's the value in research, and our physios really participating in that research because we know that the potential benefits on human health can increase productivity of population and contribute greatly to a national economy. So we've got this small scale, and also we have this larger scale in terms of national and global pictures. And now we have to look at not only clinical trials, but we have to marry that with clinical experience. And this is where a lot of qualitative work is coming in now, getting patients' views, getting clinicians' views, and really marrying this kind of information together. And of course, with evidence-based practice, we have to put that then with patient values. And again, we need research in that area. For evidence-based practice, we should be kind of having great knowledge in all those three areas together. So that's the Institute of Health of Medicine's take. So just for a second, looking at trends in physiotherapy research. So this was published in 2019, and it looked back on physiotherapy research over the previous kind of years. And it looks at, well, what is the kind of trend in research? So in all human-based health research, we have improved from 0.5% to 2.5% of research. So exponential increase when you think of the amount of papers that are published now, exponential increase in physiotherapy-based research indexed with physical therapists on PubMed. Then we look at as a percentage of health research. So we have improved from 38% right up to 58% of health research. So there is such improvements in this area. They commented that RCTs, randomized controlled trials, were increasing year on year by 6%, and an even larger increase for systematic reviews. That year on year, we are producing more research and reviews in that and publishing them in these indexed journals. If we look at age groups, so over the course of this study, over that 20 years, there was a significant decrease in the amount of studies looking at pediatric populations. And again, we need to look at that now. What are the trends in that population that maybe physio need to look at? But there was no change in terms of our research in adults and older adults. And then just, I guess, finally looking at what are the areas that we're doing research in. This is really important. These are areas that we really now have evidence that we need to contribute to patient care, and we are doing that in a lot of areas. and how do we continue that? Well, the top two are the nervous system and MSK, musculoskeletal conditions. They were the most commonly researched. Then we had a decline, I suppose, over the course of this study in cardiovascular and pulmonary research. And we had an exponential increase in neoplasm and in cancer research, which has really taken off during this period. So we have a wide range of research in these areas, and it's really important. And they put it down to these trends. And really, if we talk about the importance of research and building it going forward, we need to continue to build on these trends. So one is increased awareness, and initiatives like this tonight and a lot of member organizations coming out with guidance in this area will increase awareness of the need to advance the physiotherapy evidence base. There's now a lot of physiotherapists with graduate degrees that have a lot of research skills, and we need to really harness that. And we also have a lot of research embedded in our undergraduate programs. And we now, again, are seeing the benefits of that in terms of the research that's coming out and being published. We also, I guess, see that, say, nursing was included in PubMed as a mesh term in the 1960s. Physical therapists was added in 2012. So they also feel that that's greatly increased the number of papers that we can find now that are specific to physical rehabilitation and physical health. So I really just wanted to talk about impact and give one case study on the impact of research. And this is a busy slide, but it just emphasizes that we need to look at impact in the long term. So in the short term, yes, we get our publications, but in the long term, the potential for impact is huge. We can see here there's policy making. We know now once you have a study, then we have something to talk about. We can meet with policymakers. We can actually contribute to the information base that policies are made from. And then when we go further, we have evidence-based practice and filling unmet clinical needs, for example, looking at the quality of the care that we contribute, looking at cost savings, resource allocation. It's very important. So if we're looking at health impact, we want to make sure that patients get maximal benefit and that we minimize research waste. And that's really what's happening now. And I just wanted to give one example of that. So this is the UK's Research Excellence Framework. So they ask HEIs, so universities, to demonstrate the impact of some of their research. And this is published, I've just taken one example. So this is Jackie Morris's work, she's in Dundee, and they got about 300,000 pounds worth of research to look at stroke outcomes. And she focused on three areas. Those three areas really aren't important. But when they wrote up the impact of their research, this is what they were able to say. So physiotherapy research focusing on rehabilitation after stroke. Their research then informed the Canadian stroke best practice guidelines. It highlighted in the stroke handbook the role of physiotherapy for stroke rehabilitation, and that's used by 50,000 to I suppose assess 50,000 stroke survivors. They were able to quantify the amount of people that were affected by this. Their studies, they had 6 publications, they had 2 Cochrane reviews and some systematic reviews. And then they were able to say, well, their reviews were included on the Dutch physiotherapy guidelines. The Australian government cited some of their reviews when they were looking at what quality indicators they should have post-stroke in terms of how quick patients should receive rehabilitation after stroke. And the American Heart Association also consulted them and cited them when they were creating their strategic policy statement. And this is published, you can look at this online, but it's very convincing in terms of, okay, the international impact of this funding given to these researchers was very wide. And we know that the research area, health research in the UK is worth about £2 billion every year. So what we need to start doing now is showing the impact that research can have. And then that research influenced policy and ultimately led to a change in rehabilitation service delivery for patients with stroke. They looked at local need as well. So that was very international, but they saw a change in the amount of stroke rehabilitation that patients in their area, their hospital, their area received. And they also did a lot of work on physical activity after stroke. And they had local health commissioners then bought into the idea that they actually needed more services for patients to be physically active after stroke. And they showed that those services then improved. So really close look at impact. So if we're going to, I suppose, do this in the area of physiotherapy, then we need to support therapists, I guess, to come out with this evidence and then support them to really kind of, I suppose, work with a lot of the findings of their research to make sure that they do reach impact on a national and international level. So to encourage physios to continue to be involved in research or to start being involved with research, these papers from Sweden looked at what is needed. And there's things needed on an individual level. We have to make sure that patients have, or that physiotherapists have a good attitude and are motivated to engage in research. From a workplace level. Actually, one of the strongest needs was leadership support, so management support for patients to take on research. They need resources, they need to find out information, and outside of their organization, they need the environment of support of conferences and so on, to be able to, I guess, navigate developing a research question and then developing, I suppose, proposals and the paperwork needed, I guess, to get research off the ground. So really insightful and gives us an idea of, I guess, how we can encourage research going forward. So from this talk, I guess we've just highlighted that there is now an increasing level of physiotherapy research out there. We know, though, that physiotherapy is constantly evolving. Our areas of practice are constantly changing, and there's new areas that need further research. And the CSP's document I've just referenced this here that identified 10 areas that needed research input, but I suppose there's an equivalent document in a lot of specific areas of practice and so on. So we really need to make sure that physios are continue to be trained in this area, and then not also trained, but when they start working clinically, that research continues even in the clinical environment. So that's the kind of nurturing the research requirements of physiotherapists. And then broadly, I guess we need that further collaboration. We need closer bonds between academic institutions and clinical sites to make sure that really relevant research questions are asked, and then we're able to answer those research questions with populations that are, accessible through the clinical sites, and that we're really, I guess, jointly asking and answering those research questions. And that collaboration really is key.